Hey everyone, welcome back to the channel. And today we're talking about something that touches every romantic relationship, whether we admit it out loud or not. And that's the real foundation of a satisfying intimate life, which has almost nothing to do with tricks or techniques, and almost everything to do with connection, safety, and communication. So let's get into it, because so many couples come to me or write in, or search the internet at 2am looking for some secret move that will transform their sex life overnight. And I want to gently push back on that whole premise, not because pleasure doesn't matter. It absolutely does. But because chasing a mechanical shortcut usually skips the one ingredient that actually makes intimacy feel good, which is genuine attunement between partners, meaning the ability to notice, ask about, and respond to what the other person is actually experiencing in the moment rather than performing a checklist learned from a video. And research in relationship psychology backs this up again and again. Studies on sexual satisfaction consistently find that communication quality, emotional safety, and mutual responsiveness predict satisfaction far more reliably than any specific physical technique. So if you remember nothing else from this video, remember that the single highest leverage thing you can do for your intimate life is to get better at talking about it, both giving and receiving feedback with curiosity instead of judgment. And that starts long before you're anywhere near a bedroom. It starts with how safe your partner feels bringing up an uncomfortable topic with you at all, whether that's a preference, a boundary, a fear, or simply a not tonight. And if your partner has ever felt dismissed, mocked, or pressured after being vulnerable about something like that, it creates a kind of guardedness that no amount of technique will undo. So the real first step, and I mean this sincerely, is building a relationship where both people feel like their no will be respected exactly as readily as their yes. Because paradoxically, that's what makes an enthusiastic yes mean something. And it's also what allows people to actually relax enough to experience pleasure, rather than staying in their head monitoring whether they're doing something right. And this matters for people of every gender, though it gets talked about differently. Women in particular are often socialized to prioritize a partner's experience over their own, to fake enjoyment to avoid an awkward conversation, or to feel like their pleasure is secondary or even a bit of an inconvenience. And undoing that conditioning isn't something a single evening or a single technique fixes. It's an ongoing practice of both partners treating each person's pleasure as equally important and equally worth taking time for. So practically, what does this look like? Well, it starts outside the bedroom entirely, with what sex therapists sometimes call the State of the Union conversation, a low-stakes, non-judgmental check-in where you ask your partner things like what's felt good lately, what they've been curious about, whether there's anything they'd like more or less of, and crucially, you receive the answer without getting defensive, without turning it into a referendum on your adequacy as a partner, and without immediately trying to fix everything in the next 5 minutes. Sometimes people just want to be heard. And knowing that you can share something honest and have it land as useful information rather than criticism is what builds the kind of trust that makes physical intimacy better over time. Another practical tool is what's sometimes called the yes, no, maybe list, which many couples and therapists use as a structured, low-pressure way to explore interests individually and then compare notes together. It takes the spontaneous, potentially awkward, so, what do you like? Conversation and turns it into something more like a shared project, which a lot of people find takes the pressure off, and it can surface things neither partner would have thought to bring up cold, beyond structured tools. In-the-moment communication matters just as much. And this is where a lot of people get stuck because they're afraid that saying anything during an intimate moment will ruin the mood. But in practice, brief, warm, specific feedback tends to do the opposite. Phrases like, "That feels really good," right there. Or, "Can we slow down for a second?" Or, "I love it when you do that," give real-time guidance without turning things clinical. And over time, couples who practice this kind of communication report feeling more connected, not less, because it signals genuine presence and attention rather than each person running through a private mental script. It's also worth talking about the emotional and psychological side of arousal, because pleasure isn't purely physical. Mental state matters enormously. Stress, distraction, body image concerns, unresolved conflict, and simple exhaustion can all significantly affect how present and responsive someone feels. So if a couple is going through a stressful period at work, or there's an unresolved argument sitting in the background, that context doesn't just disappear once the lights go off. It often shows up as difficulty relaxing, difficulty focusing, or a general sense of disconnection that no specific physical approach will resolve, which is why addressing the relationship as a whole, not just the physical dimension, tends to produce much more lasting improvements in intimate satisfaction than searching for a specific move or method. Another dimension worth mentioning is the wide natural variation between individuals, arousal patterns, sensitivity, preferences, and responses vary enormously from person to person, and even from day to day for the same person depending on factors like stress, hormonal cycles, medication, sleep, and general well-being. And this variation is completely normal. It's one of the reasons generic advice or techniques marketed as universally effective often fall flat. What works wonderfully for one person or one couple may do nothing at all for another. And treating your own or your partner's body as a unique thing to learn about together, through patient, curious exploration and honest feedback, tends to be far more effective than importing a one-size-fits-all formula from something you watched online. Patience is genuinely part of the process here. Many couples report that their intimate connection improved not because they found some breakthrough technique, but because they gave themselves permission to slow down. To stop treating intimacy as a goal-oriented performance with a single expected outcome, and to instead treat it as an open-ended shared experience where connection, pleasure, and even occasional laughter or awkwardness are all perfectly fine parts of the process. This reframe, from performance to presence, comes up again and again in couples counseling and sex therapy, and it's one of the most consistently cited factors in improved satisfaction over time. It's also worth touching on the role of general physical and mental health. Adequate sleep, regular movement, stress management, and open communication with a healthcare provider about any physical symptoms or concerns all play a meaningful role in intimate well-being. And if either partner is experiencing persistent pain, discomfort, or a significant change in desire or response, that's worth bringing to a doctor or a certified sex therapist rather than trying to troubleshoot alone. Because there can be underlying medical or psychological factors that a trained professional is much better positioned to help with than a generic online technique ever could be. Certified sex therapists and AASECT-accredited professionals in particular are trained specifically in this area and can offer guidance tailored to a couple's actual circumstances rather than a generic approach. So if you or your partner are struggling with something that feels persistent or distressing, please don't hesitate to reach out to one. There's no shame in it at all. It's simply specialized healthcare. To bring this back to the core message, if you're watching this hopping for a single technique that will transform your intimate life overnight, I gently encourage you to redirect that energy toward the things that actually move the needle. Building emotional safety, practicing honest and kind communication, treating pleasure as something to explore together rather than perform, respecting each other's pace and boundaries, and taking care of your general physical and mental health. These aren't as flashy as a headline promising an instant result, but they're what the actual research and the collective experience of therapists and educators in this field consistently point to as the real foundation of a satisfying intimate relationship. And the beautiful thing about investing in these foundations is that the benefits extend well beyond the bedroom. A couple that communicates well about intimacy tends to communicate better in general. A couple that respects boundaries in one area tends to build a broader culture of respect and trust. And a couple that treats each other's well-being as equally important tends to have a stronger, more resilient relationship overall. So if there's one action step to take from this video, let it be this. Have one honest, curious, non-judgmental conversation with your partner this week about what feels good and what you're curious about exploring together, not as a performance review, just as two people who care about each other getting a little better at understanding one another. Thank you so much for watching. If you found this helpful, please like the video and subscribe for more honest conversations about relationships and connection. And I'll see you in the next one.